99.9 KTDY, the best variety of the 80s, 90s, and today. And Avril Lavigne, CJ and Deb, and Dr. Kevin for Wellness Wednesday. You're back.
I'm back. Good morning.
Good morning. Welcome back.
Yeah, I had a good little vacation last week.
Good for you.
I'm glad to be back.
So what do you bring to the table today, Chief?
Well, I wanted to conclude our series on diabetes today. And you know, I really hope folks have learned some details about this terrible disease that's plaguing America. And so just to kind of recap just a little bit, in our first show, we covered how common this disease is now. And we stated that the rates for diabetes and prediabetes have doubled in the last 2 decades, which is really an astounding rate. And we went over that the rates of teen and child diabetes has now risen to a rate never before seen in the history of mankind. And that the average American now eats 180 pounds of sugar a year, year after year after year. And, you know, when I see these very young babies drinking juice in their cups all the time, or I see these babies chewing on candy before they're even 6 months old, or, you know, these teens loading up on sugar in every single thing that they eat, it's no wonder that we have these rate increases. You know, just this morning, I saw on the news, on Channel 3 News, that out of 50 states, I don't know if y'all saw this or not, Louisiana ranks 47th.
We had the story
Deb had the story
in child health.
Yep.
Yeah.
I mean, that we really need to turn this around.
You know, I gotta say it like I see it. You know, we should be ashamed of ourselves.
Really, we should. These are our kids. You know, this sets up their health now. And the things they put in their body and how they treat their body now sets them up for their entire life of how healthy or not they're going to be. And so parents really need to be aware of how all that sugar really sets their child's body chemistry for a lifetime of health problems. And we really need to try to eliminate sugar in our diets as much as we possibly can. We also discussed what diabetes actually is inside the body, and we learned that insulin's job is to transport glucose into the cell to produce energy so that the cell can effectively carry out its function. You know, cells do things. Saliva cells make saliva, stomach cells make acid, and so on and so on. So the glucose is what enables these cells to do these things. And without insulin, the cells have no energy and everything sort of starts to shut down. And then the other thing that happens is with the insulin is the body gets resistant to that, and the glucose builds up in the blood, causing urinary frequency. That causes the blood to get thick, and that affects the eyes, causing blindness. It affects the limbs, causing non-healing wounds and nerve pain known as neuropathy. It starts to affect strokes and heart problems and kidneys. And so it really affects your whole body. Now, my goal for going into all this month is to educate the public on how this disease really works. And this is really important to me because if we can offer them solutions to reduce and manage it properly, they will be much better. You know, and at the workshop tomorrow night, that's what it's going to be. I'm not one of those guys that will say, do this, don't do that. I believe that if I can explain what is actually going on inside your body and educate them on how their body will respond, they don't need a list of do's and don'ts. Because when that happens, what if they don't have their list? What if they're on vacation? What if they're out to dinner? You know, what if they lose their list? But knowledge is something that they carry with them for their entire lives. So I'm not one of these do's and don'ts guys. I want you to actually understand how your body will respond, and so that you can know what will happen in your body and not have to rely on a list. And this has been really a remarkable difference since I sort of switched to this education technique with my patients. They leave understanding what's going to happen inside their bodies as if they've in ways they never have before. You can get a list in a 5-minute Google search, so you don't need me for that. But that doesn't change people's lives. Knowledge lasts forever. And that's really my goal with this, is to give people the understanding of what's taking place in their body so that they can make their own smart decisions. They don't need a list of do's and don'ts.
Okay.
It makes sense, though, when you understand a problem, it's a lot easier to tackle it than if somebody just says yes, no, yes,
right,
no.
Exactly. That doesn't last. Yeah, people don't follow that for the rest of their life.
But I guess people don't like to be preached at either.
Exactly.
True.
So my goal is to show you what happens in your body, and then you can make your own decisions. So the workshop tomorrow night is going to focus on the internal mechanisms of the body, why it does what it does, and I think people will leave with a whole new understanding of diabetes, weight control, energy improvement, and I've sort of boiled all this down to 5 secrets. I have 5 secrets to beating this disease, and that's why the workshop is called How to Take on Your Diabetes and Win. Mm-hmm. You can call and register now for it. It's going to be at the Hilton Garden Inn across from the Cajun Dome at 7 p.m. tomorrow night, and I'm so excited about it. It's going to be very good. So don't miss this one, guys. It's going to be great. I'm running a little long in our first segment, so we can go ahead and cut to break. But before I do, if you want to call, it's 837-7174 to reserve your seat in the Lafayette area. 837-7174. Now, in the New Iberia area, they're giving the very same workshop. That one is 367-2567. Or, you can join us on Facebook. Both numbers are on there at the Bryant Wellness Institute. So, after break, we're going to discuss 5. I'm going to tell you what the 5 secrets to diabetes management are all about.
Fantastic.